Hello and welcome to this SIU Medicine Minute. I'm Natalie Moreau and today we are joined by Dr. Christopher Lawrence. How are you doing today, doctor?
Hey, doing very well.
Okay, well, can you tell our audience about coronary artery disease?
Sure, so coronary artery disease is the development of having little bits of fat or lipid build up in the coronary arteries, which are the blood vessels that supply blood to the heart.
And then can you tell our audience also what are some signs that you may have coronary artery disease?
So I'd say patients usually first notice this they develop chest pain, particularly with exertion, and that's called angina. Commonly it presents when patients are mowing the yard or raking the leaves in the summer. As the disease progresses, you may notice it at rest. Sometimes it presents with chronic fatigue.
Okay, and then what treatments can be done when you do have coronary artery disease?
So there's a whole kind of list of treatments. I'd say we usually start with the most non-invasive things, which are medications. Medications such as aspirins or statins, typically prescribed by your family medicine doctor or a cardiologist. As the disease progresses, and usually as the symptoms progress, most patients will go on to receive either a stress test, which is followed by a coronary cath, and if that shows disease, sometimes that needs stenting in the form of percutaneous intervention. Once the disease becomes more advanced, and depending on where the disease is or if there's a lot of it, then patients may end up getting referred to me as one of the surgeons, in which case the patient needs to receive coronary artery bypass.
And for someone who doesn't know, what is stenting?
So stenting is essentially putting a small wire into the coronary artery across the blockage, and a balloon goes up to push that plaque out of the way, and a stent kind of holds it in place.
And then what are other ways to reduce the risk of coronary artery disease?
So I think controlling a lot of the comorbidities that go along with coronary artery disease. So if you're a diabetic, we know that that's a risk factor, so controlling the diabetes. Patients that are smokers, tobacco is a huge risk factor for coronary artery disease, so trying to stop smoking, controlling your blood pressure, eating right, exercise, kind of those things.
Amazing. Well, thank you so much for joining us today, Dr. Lawrence.
All right, appreciate it.
Of course, and this has been another SIU Medicine Minute.
Thanks for watching the SIU Medicine Minute. For more information, visit our website at siumed.org.